Good morning or good afternoon if you're located further east from where I am here in Waterloo. It's a very early morning here in Waterloo, as I mentioned. Welcome to the Water Institute's research conference, Water as a Foundation for Healthy Communities and Sustainable Livelihoods. I want to start by acknowledging that I'm participating today from traditional territories of the First People. I'm on land that is part of the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our campus is situated on the Haldeman Tract, land that was granted to the Six Nations and includes 6 miles on each side of the Grand River. The University of Waterloo and the Water Institute are committed to raise awareness and contribute to the calls for action of Canada's Truth and Reconciliation Commission. Back to the conference. The conference is part of the research conferences the Water Institute organizes every other year. Our last conference was in October 2020 and also virtual due to the pandemic. Focusing on the question whether we can achieve Sustainable Development Goal number 6, clean and safe water and sanitation for all in a post-COVID world. We had participants from all over the world reflecting on the impact of the pandemic on the water sector and how this affected in turn water supply and the importance of safe and clean water to control the pandemic. We heard about the inequalities of access to clean and safe drinking water in the world and how these were exacerbated by the pandemic. Today, 2 years later, we're still in a pandemic and still running the biannual Water Institute Research Conference online, but the situation has improved considerably around the world. There is a vaccine and many of us have been vaccinated, and the world seems to operate and function almost again as before, but we witness significant differences in vaccination availability and access around the world, and not everyone was as privileged as many of us here in Canada to receive the vaccination. I hope and I wish that you and your families are all well and healthy. The advantage of having a virtual conference is that it allows us to connect to many more people around the world who would not have been able to attend in person, but we obviously miss the social interaction and the importance of networking with other people. No matter how hard we try, it will never fully replace the experience and sensation of meeting each other in person. We nevertheless tried our best to put an interesting interactive program together by including both panel discussions and keynote speeches. You're all very welcome to submit your questions and comments during the coming 3 days in a Q&A box. We will try to get to your questions during the event, but in case we don't, for example, because we run out of time, we will try to get back to you afterwards with the speakers and panelists involved. To avoid online fatigue, we spread the conference over 3 days and limit the daily sessions to maximum 3 hours per day. Starting very early on Canadian side to allow as many people as possible to participate, in particular our network of scholars in the Queen Elizabeth Scholarship Program that we coordinated out of the Water Institute over the past 5 years with the same name as the conference, Water as a Foundation for Healthy Communities and Sustainable Livelihoods. More than 35 QES scholars and associated partner institutes from around 15 different countries in Asia and Africa participate in the conference in the coming days. The QES program provides essential funding for the research of all of these scholars. And I'm very happy we have the QES program manager with us, Jean Gallagher, who will say a few words about the program in a few minutes. As you may have seen on the conference website, the 3-day international conference will explore progress against the Sustainable Development Goals at the intersection of water, health, food, and gender through the work of international experts and early career scholars from Canada, Africa, and Asia, who will share research experiences and lessons learned from a variety of multi-sectoral projects led by academic and local partners. I hope the program is to your liking, that it is informative and inspiring, and I wish you all a great next few days. Thank you all for being with us here at the conference. It's my pleasure now to introduce Katie Bryan to you. Katie is a program officer at the International Development Research Center, IDRC, that helped support the QES program. Katie, thank you very much for being here with us at this early hour. I'm happy to hand over the floor to you.
Good morning. Thank you. Thanks very much, Roy. I'm just going to share my screen. Okay. Can everyone see my screen, hopefully?
Yes.
Okay, great. So Good morning, good afternoon. I don't think we have anyone in an evening space yet, but if we do, good evening. I'd like to just thank Professor Bauer and his organizing committee for involving me in today's program. And I just wanted to offer a few reflections from Canada's International Development Research Centre, talk just very briefly about the program that I come from within the centre, which is the Education and Science Division. And the program as a division in which we've been connected to the Queen Elizabeth Scholarship Advanced Scholars Program since 2016. And then just talk very, very briefly about the importance we see of the QES-AS, or the Queen Elizabeth Scholarship Advanced Scholarship Program. So just this brief background about IDRC. IDRC receives its funding from the Canadian government. It was actually, it's been in existence since 1970, and it was actually an act of parliament and became a crown corporation at that time. And really our purpose is to support Canada's foreign affairs and development efforts in the global south. We do that in a very different way than I guess Global Affairs Canada would do, in the sense that our purpose is to champion and fund research and innovation that happens within and alongside regions in the global south. We have offices across the global south in Montevideo, in Amman, Jordan, in Senegal, Dakar, Senegal, Nairobi, Kenya, and also in India. And we also, in doing this work, we invest in high quality research, as we're about to hear today. A lot of high quality research has been invested in. We share knowledge with researchers and policymakers with the intent of having greater uptake and use, so ensuring that solutions are devised with evidence. And we also mobilize global alliances in ways that can build a more sustainable and inclusive world. Our work at IDRC is guided by what we could call a new strategy, although it started in 2020, but it's a strategy 2030 in which all 5 divisions, so there are 5 divisions at IDRC, and each division seeks to address the respectively aligned sustainable development goals. And as I mentioned, since 2016, we have, in collaboration with Canada's Social Science and Humanities Research Council, or SURE, otherwise known as SHRC, supported the Queen Elizabeth Scholarship Advanced Scholars Program. And we've done this also in partnership with Universities Canada. We're about to hear Jean talk about the QES-AS program more in depth, as well as the Canadian Federation of Communities and also the Rideau Hall Foundation. So, what is the Education and Science program about, or division about, at IDRC? Just briefly, we're focused on the development problem of there are less strong education, science, and technology and innovation systems. We perceive these as being foundational to inclusive development and to restarting progress on the SDGs, particularly following the COVID-19 pandemic. So that's really what the focus of our work in the education and science program, particularly the inclusive science and innovation part of the education and science program in which I work, focuses on. And a key focus in this is trying to address the insufficient investments in research and innovations in the global south, and also how those insufficient investments affect women scientists, and why we have such few or fewer women scientists and researchers in the global south than potentially in the global north, although we must admit that it's also an issue in this context part of the world as well. And so what is the importance of the QES within the Education and Science program division, but also within the IDRC itself? And one of the key important pieces of the QES-AS to IDRC's vision is that it addresses limited opportunities for all early career researchers. And what I mean by that is doctoral researchers, postdoctoral researchers, and also those at the early stages of their career after finishing their doctoral studies. And this is both in the global south and in Canada. As we see from today's conference program, or the conference program for the next 3 days, we see that the QES-AS also provides opportunities to really use an interdisciplinary lens to do this work and work towards inclusive development and also achieving sustainable development goals. Thirdly, it also helps, and I I hope and I think already this is building a long-term sustainable South-North and South-South partnerships and networks, ones that we like to see continue because we know it's about long-term sustainability and relationships that really are going to solve the challenges that we face today. Also, very interestingly about the QESAS program is it offers very practical experience to those of us, and I put myself in there having only just recently left the academy, those of us who are inside the academy, it gives us time and opportunity to have a practical experience by working with various organizations outside of what we could call quote unquote the ivory tower, right? And think about how does the research work that we're doing in academia have practical application in these the research placement component of the QSAS program outside of the academic space, be it in NGOs, think tanks, policy organizations, and different areas outside of the academy. And finally, the QESAS has had a strong focus, and of course, given what I just said about the education and science program and our work towards really ensuring that we have inclusive innovation, that we're ensuring that we have women researchers in the science systems in the global south as well as the global north, and we're ensuring that we're having representation of people from marginalized groups as well. But the QSAS has really had a strong focus on ensuring that we have gender equity in the academy and science systems more broadly. There's been a very strong emphasis in this program that 50% of scholars that are being mobilized both to come to the global north or go to the global south from the Canadian university partner are female. So this is a very key component of this program. So with that, I'll pass the floor over to our back. I'll pass the floor back to Professor Brower, and I just wanted to say, again, thank you for having me today, and congratulations to hosting this session. I know how difficult it can be to have conferences in an online forum rather than although it's been a long time, how we were used to doing this pre-pandemic. Thank you very much.
Thank you very much, Katie. I'm now happy to briefly introduce Jean Gallagher to you. Jean is the QES Program Manager at Universities Canada, and we're also very happy to have her here with us to open a 3-day conference and tell us a bit more about QES. Jean, I'm happy to hand over the floor to you.
Thank you very much. Thanks, Katie. It's always nice to have IDRC represented. And thank you very much for the Water Institute for including us. Happy to get up very early. The lack of commute has come into to our advantage this morning. Thanks once again. It's not an opportunity that we often have to put management of a scholarship program in direct connection with participants. And so this is a wonderful occasion for all of us, but especially me, to hear a more direct impact of the work that you're doing. Roy, it's difficult to believe that it goes back to early 2017 when we sat down together at the University of Waterloo and you explained your project and your outputs and all the wonderful things. And here we are already moving on to the next step. Julie? We're having technical issues. I'm having technical issues this morning. And so Julie has kindly offered to act as my technical representative. So although the QES program was complex, some would say in some cases overly complex, it at its simplest was about global citizenship. And I particularly like the WEF definition. You may want, I will save you having to listen to me read it, but if you want to take a couple of seconds to read it, it brings things down to a very simple explanation that I think is very appropriate. I particularly like our well-being and success are ultimately interdependent. And I think we've seen that over the pandemic. So this one, just a really high level overview. It was established in 2012 in honor of Queen Elizabeth's Diamond Jubilee. So far, over 2,200 scholarships have been awarded, And QE scholars have gone to or been from 76 countries, thanks to 106 projects, such as this one, developed and managed by 46 Canadian universities. The QES, the QES Advanced Scholars Phase, yes, we all have our acronyms, included 21 projects and was funded through the generous support from IDRC and SSHRC. 369 researchers were funded, 82% of whom were from the Global South. We're particularly happy with that number, as well as the almost 51% female participation, as mentioned by Dr. Bryant. Julie? I've lost my screen, so I don't know if you're on the what screen you're on now. I apologize for this, everyone.
You have the program overview.
Yep.
The implementation model.
There we have the wonderful spheres that shows that at the center of all activities was the scholar. And a scholar never works alone. And in this particular case, there was a Canadian institution. There was the LMIC partner, either hosting, sending, working with, but there was also the research placement partner, which, as described by Dr. Bryant, was an important component and gave a chance to get some out of academic experience and seeing how the real, and I hate saying this because I'm with a bunch of academics, how, I don't want to say the real world works, but how a different perspective can add to a researcher's overall view of the world. Next one. So I won't read all the stats to you, but some that I'm particularly proud of is that 97% of scholars reported the QES experience had strengthened their knowledge and skills. 94% of scholars, and this is specific to the AS researchers, 94% of scholars reported increased leadership skills, and 91% of scholars reported time spent with their research placement partner met their expectations. All of these stats are impressive, but especially so when you also consider that a number of researchers undertook virtual activities. And had anyone asked most of us 2.5 years ago if the results could be this strong, if some researchers were limited to virtual activities, I'm not sure we would have been as confident in predicting our results. Another input that I would like to celebrate is that while there are a number of program outputs, this one speaks volumes. The number of reports, blogs, posters, presentations, and publications produced by the QES-AS scholars. Keep in mind that this involves 369 researchers, which is a relatively modest program. It's not the largest program ever funded, but to have this number of outputs in what can be a relatively short period of time by a relatively small number of researchers is quite impressive. Through their eyes. I've called this slide Through Their Eyes because I think it's also important for all of us to see the program from the participants' point of view. So we analyzed participants' reports to pull out the words most often used to describe their QES experience. And here are the top 10. Maybe take a few seconds to see how 369 researchers from different countries at different points in their professional careers and working in different areas of focus describe their QES experience. Happy to see that gender consideration was in the top 10. And the one, no surprise, the one that stood out, and you can tell by its size, it's the whole idea of multidisciplinary. Global reach. This, I think, is a great visual representation of the network of funded researchers, 45 countries. Can you imagine? It's again, not a long-term program, but we had participants from 45 countries. We have always understood the impact of physical mobility, but over the past 2.5 years, we've seen that collaborative international research can be done, even when physical travel is limited or non-existent. Conferences such as this one are wonderful examples. I encourage each and every one of you to keep the momentum going. Reach out to both new and existing networks to see what each of you is working on and how to share your collective knowledge and experience. I think that's really the way forward to make the most of your QESAS experience, to make the most of your academic training. If you're an early career researcher or still at the doctoral level, you have so much to offer. And it's always a great idea to expand networks. There are QE scholars in your geographic area, may not be in your area of focus. There may be people in your area of focus, but not in your geographical area. There's no reason to limit your networks. It's always wonderful to find out what other people are doing. And as we all know, it's not a one-size solution to a very simple problem. My last slide, just encouraging you for more information on the QES program to visit queenelizabethscholars.ca. Under the news tab, you'll find a link to a comprehensive report on the QES Advanced Scholars. It captures a lot of key information about the many achievements of the program, as well as useful lessons learned, recommendations for the future, whether future iterations of QESAS, or more broadly, for the design and implementation of programs that support research mobility, research collaboration between countries, and engaging with research placement partners outside of the university structure. I look forward to spending the next, hopefully, 3 days, 2 for sure, with you and learning from your experiences. And if anybody wants more information on the program, please visit the website or reach out to me. I'm happy to answer any questions. Thank you. Back to you, Roy.
Thank you, Jean. Thank you, and a big congratulations with all the achievements of the program. So thank you very much for presenting this to us. Also, Dr. Brian, thank you so much, and also to you, a big congratulations with this amazing program. I'm going to move on very quickly because we're a little bit out of time already. It's time now for the first keynote of the conference, and it's my pleasure to introduce Dr. Suvigar Bhutta to you. Dr. Bhutta is the inaugural Robert Harding Chair in Global Child Health at the Hospital for Sick Children, Director of Research at the Sick Kids Center for Global Child Health, founding director of both the Center of Excellence in Women and Child Health and the Institute of Global Health and Development at Aga Khan University. Dr. Bhutta is furthermore a distinguished national professor of the government of Pakistan, co-chair of the Maternal and Child Health Oversight Committee of the World Health Organization's Eastern Mediterranean region, and chairman of the Coalition of Centers in Global Child Health. He's a leading voice for health professionals supporting integrated maternal, newborn, and child health globally. In 2020, he was named Fellow of the UK's Royal Society. In 2021, he won the Institute for Health Metrics and Evaluation's Roep Prize, and he received the John Dirks Canada Gartner Global Health Award in 2022. In his talk today, Dr. Bhutta will address the question if improving water safety and sanitation matter when it comes to child health and development. As mentioned in my introduction, please add your questions for Dr. Bhutta during or after his keynote in the Q&A box, and I'll help Dr. Bhutta to get to your questions after he finishes his presentation. Dr. Bhutta, we're very honored to have you here with us this morning. I gladly hand over the floor to you.
Thank you very much, Roy, and thank you for this invitation to join you in this fantastic conference. I just want to make sure that people can see my slides.
Yes.
So what I would very much like to do, ladies and gentlemen, I am no water sanitation expert. My background is largely global health and global child health. But I do have an interest, an enormous interest in the discipline for a variety of reasons, including its relationship to general inequities and also to development in the parts of the world that I work in. What I would like to do over the next 30 minutes or so is to talk to you about principally the context of global inequalities, especially information on water sanitation and hygiene, insofar as we know to contribution to global health, And I'd like to specifically address some of the issues that we face in Pakistan around both disparities in relation to water sanitation and hygiene, some of the recent data. I'll spend a significant chunk of my time on talking about interventions, both the global evidence in terms of what works and what doesn't, specifically referring to some of the recent controversies around trials, randomized controlled trials that have evaluated a package of interventions, and share some of our work on exemplars, which have looked at this in the context of longitudinal data from countries where there has been what we call exemplary improvement in child nutrition. And I'll try and bring it all together at the end in terms of how do we look at this as a way forward. So to this particular audience, inequalities are a part of life, and they've been around for a very long time. And in fact, if you look at the history, over time, many philosophers, including Tagore, who I frequently cite, thought this was the way life was. This was what was the fate of a large chunk of humanity, because the coverlet available to it across the world was just insufficient. And you see manifestations of these inequalities in the context of global health starkly around certain regions and around certain life periods. When you look at child mortality, this particular infographic, is one of the most important infographics that I think we have ever developed in global child health. When we developed this around 20 years ago, each one of these dots was a reflection of 10,000 child deaths. And if you look at where 10 million children were dying every year across the world, they were disproportionately and largely clustered around sub-Saharan Africa and South Asia. And this was one of the reasons why, with the Millennium Development Goals, a lot of focus was put on reducing child mortality and maternal mortality. In fact, child mortality target was around 2/3 reduction in child mortality by 2015. But people coalesced around the idea that you could do something about it, and you could do something about it at scale. And indeed, when you look at the evidence as to what happened, by 2015, we had actually reduced child deaths from 12 million or so by estimated for 1990, 10 million in 2002 to less than 6 million by 2015. And if you took the population increase into account, actually the world achieved the Millennium Development Goal 4 target of reducing child mortality. Now, this was an enormous global development. Never in the history of mankind has there been such a global progress in such a narrow time frame. But the progress, again, wasn't equal. So if you look at countries that actually led the major global average change, they were largely countries that you see in Latin America, the Brazils. China led a big chunk, Southeast Asia did, and a few other countries in Eastern Europe. So the progress wasn't equal. And you see a lot of the manifestation of those inequalities in the context of what we were able to achieve as coverage across major interventions. So this Manhattan plot that I frequently show from our countdown work, which looked at the coverage of various interventions across the life course, particularly in childhood. If you look at the coverage of various interventions, we did well in certain areas like immunizations. We did very poorly around maternal and postnatal care. Each one of these dots is a country. So you can see tremendous range of coverage by countries, some as low as less than 20%, and some as high as close to around universal coverage. For water sanitation and hygiene, for the true global coverage indicators that we had, which was improved drinking water and improved sanitation, again, the jury was out. Overall, the median coverage for improved water worldwide by the end of the Millennium Goals was around 70%. But for sanitation, we were less than 40%. And it can be argued that some of these water indicators were suboptimal, that really did not cover the range of what would be safe water. This was improved water that included in many geographies, even surface water, but gave you the false impression that perhaps this was where mankind was supposed to go. When I can show you a lot of data, but I thought I would show you data from my own geography, my own country of origin and work, Pakistan. And if you look at Pakistan and trends over time by the major surveys that we have available at the household level, including 2 large national nutrition surveys done by my own team, the indicators in red are indicators for improved water by the current definitions. And straight away, you can see that there must be something wrong, because we don't see any real major difference between those who are very poor, the poorest quintiles, and those who are relatively rich. And it looks as if the country has ostensibly achieved a very high level of coverage of improved water across all provinces, even some of the poorest provinces. And you see this reflected by virtue of the definition in the maps that we have. So in 2013, this is the map of districts with improved water. In 2018, it improved even further by this demographic and health survey, but the progress wasn't equal. And if you look at changes over time, you find that many parts of the country, even by this improved definition of water, were left behind, notably Balochistan and some parts of Sindh. When you go to water quality, there are only a few surveys that have looked at this. And in 2018, my group actually did household water sampling to look at both quality as well as safety using microbiological methods and chemical assessment of water. And you can, again, see very clearly that around a third of the specimens had contamination with Escherichia coli. And this was different across various provinces. You see this pretty high in the provinces that I just pointed out to you, and around a quarter in the relatively well-off province of Punjab. So you see this graphically also with improved sanitation measures. And you can see a large chunk of the country did not have access to improved sanitation in 2018 and 13. And you see in terms of the change here, that the change has been very variable across various parts of the country. You see this a little better by the National Nutrition Survey, data on positive samples, that is the same areas with poor sanitation that have very high E. coli count. So moving forward, you want to see how these correlations of improved sanitation pan out when you plot them against nutritional indicators for those very districts. And again, without being a high-powered statistical analyst, you can see graphically that the relationship between linear growth here as stunting, for example, compared to wasting, which is weight for height, the linear growth relationship seems a little bit more robust, a bit more distributed reasonably well across various districts. The wasting is a little bit all over the place, but irrespective, when you look at the correlation, statistical association of stunting, wasting, or childhood anemia, controlling across various districts for poverty, for geography by provincial policies and administrative relationships, gender, we find that the relationship is quite robust. The children who have improved sanitation, controlling for socioeconomic gradients, have on average 13 to 14% lower rates of stunting, wasting, and anemia. So observational studies like this do suggest very strongly that these underlying determinants of health matter. And they matter a lot to child health, they matter a lot to nutrition, and they matter a lot to things like anemia, which have long-term developmental links. What about the global evidence on interventions to improve water sanitation hygiene through either behavior change or structural interventions to improve access to clean water, including point of use interventions to improve water quality? Now here, the literature is quite broad. And my group looked at this quite extensively with UNICEF a few years ago, where compared to other systematic reviews that you see over here, we were able to evaluate a wider range of outcomes, including mortality, and also look at more granular distribution of interventions. So the WASH evidence for diarrhea was very strong. It looked at both hand washing, access to adequate sources, and in all instances, there was an effect in the right direction. When you looked at sanitation and disposal of excreta, again, the evidence in relationship to linear growth and to stunting was quite strong. But in all observational studies, Alan Dangour did a large Cochrane review where he looked at this, and the effect was small, but it was there, that you had interventions to improve sanitation and disposal of excreta, and they seem to have a relationship with improved childhood growth. You see this in Dean Spear's work from the bank, where you look at the relationship of households without a toilet and latrine and the average height for age z-scores. And you can see very clearly that there is a linear relationship, which was pretty robust. And he was able to look at this subnationally in countries like India, where across a lot of data sets and a lot of serial information, he was able to document the same relationship in terms of exposure to open defecation and linear growth in children. In fact, these analyses and information were one of the first reasons why India has invested so heavily in a safe sanitation program at national level. Now, when we looked at the interventions that were available from particularly good quality interventions, randomized controlled trials, we were able to put together not a phenomenally large list, but about 30-some interventions that looked at hand washing, water quality, and safe disposable excreta. This was published a few years ago. And there are two main take-home messages from this. Our assessment from randomized trials of water quality improvement, particularly at point of use, and diarrhea was very mixed. Where, when we looked at non-confounded studies, we could not convince ourselves that there was a sustained or a meaningful impact on diarrhea reduction by point of use water quality improvement strategies. However, we were able overall to see that water disinfection and filtration in particular had a significant impact on diarrhea in a large number of studies. Now, these have been recently reviewed by Wolf and colleagues in the Lancet, particularly focused on low and middle income countries, and they make two observations, which I will share here. One is that they find that the diarrhea risk by hygiene interventions that include hygiene education and general improvement in behaviors was associated with about a 30% reduction in diarrhea risk. So quite supportive of what we had found a few years ago. And they also were able to look at sanitation services, both basic without sewer connection, unimproved sanitation, and overall, they were able to document through this meta-regression that basic sanitation services without sewer associations were associated with a significantly higher rates of diarrhea and improvements in those services with sewer connections had a higher impact in terms of diarrheal estimates. You see some of that in their evidence summarized here with a lot more in granular interventions, including point of use chlorination, solar treatment, filtration, improving source on premises, continuous supply or intermittent supply. And in all of these instances, the effect is not only in the right direction, but these interventions that they had both on premises and outside all seem to have a strong impact on diarrhea burden. So the impact on diarrhea is pretty strong. The impact on nutrition from the systematic reviews was very mixed. Now, the whole field was turned on its head by two large international studies that I'm taking the liberty of sharing with you today. You must have read about them. These are slides that have been shared with me by Dr. Jean Humphrey, who principally was focused on the environmental enteropathy hypothesis that if you invest heavily in improving water supply quality, sanitation at scale in population, that there should be an impact on growth, there should be an impact on diarrhea burdens. And because she wanted to do this at scale, they also included nutrition interventions within these trials. And they were in 3 geographies led by these specific investigators, Steve Luby in Bangladesh, Claire Null and Jack Holford in Kenya, and the SHINE study in Zimbabwe led by Jean herself and Andrew Prendergast. Now, the interventions in these studies which were largely cluster randomized trials, were geared towards assessing the combined and independent effects of improved household water sanitation, hygiene, and infant feeding. And the outcomes were linear growth and diarrhea burdens at 18 months or 24 months. And they also looked at secondary outcomes like mortality. But let's just focus on these two outcomes at the moment. And you can see the differences between these two studies. The WASH benefits study had a range of these interventions that were independently evaluated. In Bangladesh, there was a fairly large study with, as you will see, a lot of interventions. In Kenya, it was less intense. And the SHINE cluster randomized trial was a 2x2 factorial design looking at water sanitation, hygiene, infant feeding, and combinations thereof in relevance to a standard of care group. Very large trials, around 18,000 or 19,000 pregnant women with robust measurements at baseline of linear growth and an end-line survey about 18 to 24 months after the interventions began. And the pretty standardized measurements of length, which are generally problematic by trained field workers who had robust quality assessment. So the intervention, one of the big questions was, did it have uptake? So they looked at fidelity and implementation, and in all places, there was quite a significant uptake of the intervention. They also looked at how much chlorine was detectable in water samples, and with the exception of Kenya, which, as I said, was much more in the nature of an effectiveness trial, we had around 60 to 80% demonstration of chlorine in the water. So first thing to note is that in all three trials, the nutrition intervention worked. And you see the impact on linear growth, length for age Z-score. And in Bangladesh, Kenya, and in the SHINE study, in each group, there was an improvement in linear growth once you fed these children. So in the nutrition intervention group, there was a significant impact. However, when you disaggregated, the water sanitation hygiene groups had absolutely no impact on linear growth. If anything, in many cases, you see a negative effect. So there was no demonstrable change in linear growth, which was significant in any of those locations in the group that was only receiving water sanitation hygiene intervention. The combination worked, of course, but as I've indicated, slightly due to the nutrition intervention. In Bangladesh, all interventions except water treatment at point of use and source had an impact on diarrhea. And the reductions were by and large the kind of values that I've told you from our systematic review as well, about 30 to 40%. And this was significant across various groups in Bangladesh. But remember, they had quite significant impact, and this was much more in the nature of an efficacy trial with multiple visits. In Kenya, no intervention had an impact on diarrhea. See, all of these cross one. And they looked at various permutations and whether or not the intervention had fidelity in terms of coverage. So this was quite an unexpected and a negative finding from a very large investment of effort. They went back and looked at their control population to see if there were some of the associations that other people had observed at population level in observational studies. And clearly, an improved latrine at baseline was associated with better length for age Z-score in the control arm. So there was a natural association of a gradient controlling even for other factors. So a big conundrum from these studies in the global community for WASH was, how do you, first of all, reconcile the different results between the two studies? 30 to 40% reduction in diarrhea in Bangladesh, and how did these differ from evidence available from the Cochrane reviews and others? And I believe that some of the answers may lie in the intensity of the intervention. And what Jean and colleagues also looked at was what was happening in Bangladesh. That was a bit different, 6 contacts, as I said, per child. And how did these differ from what was being seen in the African sites? And the number of contacts in these places they felt was not sufficient to have a sustained impact on behavior. So the key conclusions that they were able to make from this large investment of time, effort, and I must say money, overall over $100 million were spent on these experimental studies, was that these elementary household level interventions were not sufficient to interrupt fecal-oral transmission of entropathogens. If the underlying hypothesis was that gut enteropathy and pathogens were associated with impaired linear growth, then you really needed more than just doing what they were doing, which was already quite extensive in Bangladesh compared to Africa. So they were able to analyze and see how this impact could be potentially augmented. And they came up with the thought of a transformative wash intervention being potentially better, which needs testing in the field. And the two components of a transformative wash intervention, number one, I would say three components. Now, number one is really the sustainability and sustained messaging around some of these interventions in terms of behavior change. You can't just go in one day and disappear the next, particularly in communities like what you see on this slide. This is the reality of an urban slum in Karachi, where I work. And you can see that here, sometimes even having piped water, as you see over here, in the midst of everything else, is a disadvantage rather than an advantage, particularly if the water supply is intermittent. So some of the evidence around these interventions not working if they are effectively implemented is also true. So part of the transformative wash is also to ensure that you have continuous clean water supply and that you ensure some of the quality. And the third, of course, is that the community has got to be engaged in behavior change and in changing their living condition and environment, particularly around living with animals and continuous exposure to pathogens. Now, one big question that is asked in this field is, none of these are real life examples. These are trials. And trials by design, as you see even in the WASH and SHINE studies, have a number of interventions done even in the control group that make those somehow artificial. When you go and even ask data households in terms of what is the diarrhea burden, what is happening, is your child eating this or drinking this, it changes behaviors. People sometimes will posit the answer that you want, or at other times, it will subtly change behaviors itself. So one of the big challenges relate also to the Hawthorne effect of multiple visits, as well as the fact that these are not truly observational controls, because you are doing something in terms of improving standards of living. And that's why there has been a lot of groundswell of support for looking at real life examples of change to see how things may have happened globally. And that's one of the projects that I've been engaged in the last 6-7 years with Gates Ventures. These are the Exemplars in Global Health project. We were initially very interested in looking at countries where you had stunting reduction, which was exceptional and better than what their socioeconomic growth would have predicted. So if you take the example of GDP per capita, compound annual growth rate over time, and you have linear growth or stunting prevalence with improvements at the bottom, ideally you would expect one of the best performers around stunting reduction to cluster around this quadrant, where you were able to see change without massive economic growth, which may not be sustainable or may not be possible for many countries. So if you take this average stunting reduction line, our exemplars would logically be all below it. And that's exactly the number of countries that we studied in phase 1, Ethiopia, Central Asia, Nepal, Senegal, Peru. And in phase 2, we've been looking at African examples from Uganda, Pakistan, Nigeria, and so on and so forth. So I'm going to show you just 2 summary slides, which is to look at the Oaxaca blinder decomposition as to what explains stunting change over time in these countries with individual level data available at population level. So this is a busy slide, but it makes a very strong point that in all countries, with the exception of Kyrgyzstan, where there was already a very high standard of water sanitation hygiene, wash interventions, improving wash practices, and better availability of water accounted for between 15 to 20% reduction in stunting in these countries across the board. And therefore, irrespective of what the trials show, The real-life evidence from observational data over the last 20-25 years shows a very clear association of improvement in water sanitation and hygiene with reduction in stunting in these countries. So there is something there, and it may not be operating through the linear relationship of better nutrition and better development with WASH, but it could be operating through a number of other mechanisms also, which reduce morbidity. Almost the same observation we have had through our African studies. So these are the African exemplars, the three that we have seen in recent years, Nigeria, Ghana, and Uganda. And in all three, you have a contribution of WASH, a little less in Uganda compared to Nigeria and Uganda, where a little less in Ghana compared to Uganda and Nigeria, but it's there. And you can see improvement in sanitation, reduction in open defecation, improvement in water sources account for about 15 to 20% of the reduction in stunting rates in these geographies. So real-life evidence suggests that there is something in this, and therefore we should not just give up on the basis of one set of randomized controlled trials. Well, as I close, I want to share with you some very interesting data being generated by one of my PhD students, Dr. Jay Das, from a recent large cluster randomized trial where Jay was just given one task by me. I was interested in how you could integrate water sanitation and hygiene interventions with conditional cash transfer or community supports that the government was investing in rural areas. So in this large comic trial that he has finished, he looked at the principal objective of community mobilization and incentivization on self-help basis on sustained improvements in largely sanitation. Could they invest in strategies by putting their skin in the game and improving sanitation, reduction in open defecation? So he had a three-arm trial. One was the control group, standard of care. We ran the same risk of going and collecting data and introducing behavior change. One where he only had community mobilization and education, information. And the third where we had a tiered incentivization system, whereby the community put in some resources and we put in some resources to help them create toilets and improve water sources based on a participatory program of deciding on these investments. So this developed the entire incentivization program for various villages was developed in close participation with them through consultations and also in consultation with the income support program and the rural support program who had done this kind of work before. So the study setting was in rural Sindh. I'm very sorry to say this is one of the districts that is now inundated with the floods. But it's a cluster randomized trial, and a large proportion of the district was involved in this. The clusters were selected as best as possible to reduce contamination, and a fairly large sample size here. The eligibility and receipt of these incentives was like the program. Number one, targets were determined and selected in participation with the community, and it was all validated through spot checks. Their improvements in sanitation, investments in building stuff, vaccination coverage, ORS use for diarrhea, these were all bases for continuing to provide them the resources over time. We used a sanitation index as one combined measure, but we have disaggregated data on this. And I'll show you what happened in the before and after evaluation. So we'll take the baseline, this population about 30,000, close to around 9,000 children with pretty standard ARI and diarrhea prevalence rates. ORS use is around 40–50%, and a sanitation index which was on average around 5.6 across these three geographies. It was a little better in the two intervention areas, but not massive difference. And we couldn't, of course, control for it. The clusters were determined on the basis of access to services. But note the full immunization rates in these villages, around 29% or thereabouts. Over time, and this is a trial that took 2 years to implement and finish, you see a steady improvement and over time and a pretty impressive increase in sanitation index in the two intervention groups. Compared, there was an improvement also in the control population, which we would have expected just for reasons that I've mentioned to you. But the differences here are quite significant. You also see improvements in diarrhea management with ORS use, much more so in the incentivization group than in the community mobilization group, where there was no change. Exclusive breastfeeding rates, almost the same thing. So, I mean, one thing that we learned from this was that just providing mobilization and education messages by themselves was not enough. Full immunization rates. This, to me, is the most important data that we see, that incentivization and monitoring and community engagement led to a significant gain from baseline on full immunization rates. And very interestingly, although these data are need to be vetted and checked, a reduction in diarrhea based on prevalence estimates, and also an indication that it might be the case for acute respiratory infections also. In our end-line survey of the population I've mentioned to you, it seems that the mobilization with incentives is significantly better than mobilization alone in this cluster randomized trial for a range of outcomes, including breastfeeding, exclusive and early initiation, full immunization rates, and importantly, also for the sanitation index and reduction in open defecation that I've mentioned. Well, I mean, Pakistan is a country which is facing an enormous set of challenges right now. This trial tells you how much you are at the mercy of the powers that may be. This is an image from the same district today. No matter what we did, and no matter what community engagement and mobilization we did, the floods, which have been of biblical proportions, have principally laid waste to 2 to 3 years of investment. I'm very hopeful that once these waters recede from Tanda Muhammad Khan, that the population will go back to a better place than when they were before they started. But it also makes the case, as I close, of ensuring that we keep many of these factors in mind as we develop interventions, and particularly on water sanitation and hygiene. Climate change can overrun everything that you do. So integrating climate change, mitigation strategies, adaptation strategies, and a global increase in investment in this space is absolutely important. Let me finish by making a plug for our seminar in December at the Aga Khan, which is looking at water health and development. And I hope that many of the participants in the session today will be able to join. It will be a blended seminar with virtual participation possible as well. Well, thank you very much, Roy and colleagues, for your attention and for allowing me to share some of my thoughts. Thank you.
Thank you so much, Dr. Bhutta. You would have received an enormous round of applause for this amazing overview. You definitely set the scene for the rest of the conference. This was a very, very insightful presentation. We learned a lot. Thank you so much. We have time for a few questions. I see there is one question in the Q&A box already. Dr. Bhutta, if you agree, I will read it out loud to you. It's a person who is anonymous, and he talks about, or she talks about SDG 6. It's a very ambitious goal, water and sanitation for all by 2030. Development aid often requires water service providers to recover all the service costs. How can providers ensure access to all while requiring full cost recovery? Is this a conflicting mandate? And how can we ensure that the poor receive access?
Well, I mean, I think it's a great question. It's a question that I've asked myself and others who are looking at SDGs right now. First of all, I think it needs to go beyond numbers to the quality of water sanitation hygiene interventions. And there is a tendency at this point in time to achieve or reach that SDG target by just artificially capturing community indicators or population-based indicators that do not necessarily capture the ethos of the intervention itself. I think I alluded to that by saying just having improved water is not enough, because improved water masks behind it a lot of unsafe water and interventions that truly do not reduce bacterial contamination and exposure of young children to intropathogens. So we need to look at quality of water sanitation services. We need to not just be measuring how many people have piped water, but also look at whether that piped water is continuous or intermittent. And there's enough evidence now, at least from the typhoid field that I also overlap with, that intermittent water supply with prolonged closures and blockages is actually a higher risk factor for some of these enteric infections than not having that piped water at all. So we need to look at some of that evidence very clearly. And finally, I think there is money involved here. To pass the costs of investments in a basic human right, access to safe water and sanitation, to pass those costs to the community, I think opens enormous ethical challenges for people. Like education, this is a right that the state has to provide. Remember, when we did our incentivization project with the community's investment in that was in kind. We did not take any cash or ask them to put any money on the table. We asked them to provide a space. So the community would contribute space where a toilet would be built, and to provide labor and effort, which they were very happy to provide at off time, but it put their skin in the game. But to ask them to put money on the table when they have nothing to eat for water, sanitation, hygiene, I think is unconscionable. This is an investment that the state has to make, which means that in turn, this is an investment that lenders, development agencies have to make. I have never, ever in my experience in Pakistan or elsewhere, seen the International Monetary Fund ever put a conditionality to say you will not tax X, Y, and Z on water, sanitation, hygiene, that you will preferentially invest in water, sanitation, hygiene services for you people. They always end up by passing the buck to the community, to poor people, without any realization that it has a downstream effect on some of these basic infrastructure needs. So I think the development community also needs to wake up to see what is a collective responsibility. I've just shown you an image of Pakistan. It's not Pakistan's fault that 1/3 of the country is inundated. We didn't bring those rains. These rains are unseasonal and unprecedented. They came from a part of the region where they've never had monsoons come from. They came from Rajasthan. They usually come the other way around. They came and they were biblical, as I said, because it rained torrentially for 11 days and nights. Yesterday in Toronto, where I am right now, there was torrential rain and I could barely prevent flooding in my backyard. So you can imagine if it rains like this for 11 days, nobody can overcome this. But whose fault is that? Is that Pakistan's fault? Or is that the fault of the developed countries where they are responsible for a lot of the carbon emissions? Pakistan is responsible for less than 0.5% of the global carbon emissions. So I think there is, in the context of SDGs, a wider responsibility as to who's supposed to be investing in SDGs for the rest of the world.
Thank you. We have another question from Susan Elliott. One of the take-home messages for her is the need to bring many different types of scientists together to address these global problems. What is, in your view, some of the ways we might be able to encourage this?
So it's a great question, Sue. I often tell people that if I was to live my life again and go back to school, the one set of courses that I would take would be in anthropology, because at this stage in my career, having done more cluster randomized trials than maybe any other group out there, one thing that I still don't understand very well is how do you change in a sustainable manner community behaviors practices? And therefore, to bring into these studies of interventions and change the disciplines of social sciences, anthropology, understanding, gender-related issues is almost fundamental to the scientific design of these studies. So I think the only way forward is to really create multidisciplinary groups. As Sue, you are aware, in the Institute for Global Health and Development that I head at Aga Khan University, we have made an enormous effort to reach out to people who bring various disciplines to the table that we don't necessarily have from the health side, economics, anthropology, social sciences, community development, and increasingly people who are focused on inequities and reduction in inequities at population level.
Thank you very much, Dr. Bhutta. We had one more question, but I think my colleague Julie deleted it. Also, in view of the time, I propose we leave it at this. We will look up the question, Dr. Bhutta, and we'll send it to you. It was from Florence. Florence, apologies for not reaching to your question. But in view of the time, I propose we stop here. Dr. Buddha, thank you so much for your contribution and your insights.
Thank you.
It was an amazing presentation. Thank you for sharing your experiences and your research with us. We're going to thank you very much, sir. We are going to skip the break, and I propose we move straight into the first panel discussion led by Diana. So apologies for not allowing you to take a 5 minutes break, but in view of the time, I would like to introduce the first panel to you, moderated by Dr. Diana Karanya. She's the director of the Community Health Support Program COHESU in Kenya. She's been a health researcher for many years with a focus to expand understanding of the epidemiology and control of diseases that impact community health and well-being. Before joining COHESU in 2020, Dr. Karanya was the Chief Research Officer at KEMRI, the Kenya Medical Research Institute, for almost 2 decades, coordinating and implementing numerous laboratory and community-based studies in collaboration with local and international universities and organizations, including World Health Organization, U.S. Centers for Disease Control and Prevention, Bill and Melinda Gates Foundation, and last but not least, the University of Waterloo. Diana, thank you so much for joining us from Kenya. I'm happy to hand over the floor to you and your panelists.
Thank you very much, Roy, for that introduction. And I'd like to welcome everybody to this first panel session. And like Roy said, my name is Diana Karanya, and I'm currently the Director for Community Health Support Program. It's an non-governmental organization based in Kenya, and we work with child and adolescent health in communities. We also work with women and water and sanitation and economic development for economic empowerment for women for development. And the previous presentation was extremely interesting to me because we, in our work with women at water and sanitation at household level, and I picked up a lot of interesting things that we can do and how to move forward. And I'm really happy to be the moderator for this session. And in this session, we are going to look at, we are going to hear from our 3 panelists and about the experiences with the Queen Elizabeth Scholar Program. They will tell us who they are, what they worked on, what the practical outcomes were of their projects, and how they experienced the international and local collaborations. The collaborations was a very interesting and very powerful aspect of the Queen Elizabeth Scholar Program. And then they're going to tell us how the collaborations helped the successful outcomes of their projects. And also we are hoping they can share what kind of lessons they learned. And so to move forward, I would like first of all to Thelma.
Hi.
Thelma, hello.
Yes.
I would like to start with you, Thelma. Could you please just briefly introduce yourself? Tell us what your field of expertise is and what you worked on the Queen Elizabeth Scholar Program. And also we'd like to hear about who you worked with and how that went.
Okay. So thank you so much for I'm so excited to be here. And to start with, I am Thelma Zulfawa-Abu, as you rightly said, Diana. I have a background in environmental science and health geography. And my research interest areas include global environmental change that has to do with climate variability and change. I'm interested in environmental health inequalities and also global health equity. And currently, I am an assistant professor in the Department of Geography at UConn, University of Connecticut in the US. And I earned my PhD degree in geography at the University of Waterloo, and I worked with, or I was under the supervision of Professor Susan Elliott, who is on this meeting right now. And so as part of my PhD, I did work on water insecurity, specifically looking at water sanitation and hygiene in healthcare facilities in Kenya, and how this challenge impacted issues related to quality service provided in healthcare facilities that has to do with infection prevention and control, as well as the impacts of water insecurity on universal health coverage and emergency preparedness, and even health promotion and education in communities. Those came up as well. And my work was guided by Sustainable Development Goal 6 that talks about clean water and access to clean water and sanitation, as well as Goal 3 that talks about good health, promoting good health and well-being, but target 3.8 of Sustainable Development Goal 3 talks about, integrating quality service in universal health coverage plans globally. So these two goals did contribute a lot to the work that I worked on in Kenya. So in 2018, there was a global call to action to ensure that universal health coverage integrates the qualitative aspects of it, that is ensuring that we have adequate infection prevention and control measures in healthcare facilities. And later in that year, Kenya began to pilot universal health coverage, and Kisumu, which is one of the communities that I worked in, Kisumu, which is one of the counties that I worked in, was one of the counties that this program was piloted in. So it was an opportunity to explore to what extent these global campaigns influenced the national movement in trying to implement universal health coverage. And my work was done in two phases, pre-COVID and post-COVID. And I would like to touch on two main outcomes. And the first one I want to talk about is the issue of strengthening WASH monitoring and measurement, as well as the enforcement of these policies in Kenya. So before I went into the field, we began doing some policy reviews, and we realized that Kenya had some very wonderful policies surrounding improving, water sanitation and hygiene access. And also in some of these policies and plans, there was that, recognition that there is the need for these services. But in actual fact, access is still a problem in many parts of Kenya. So we also looked at, when I was in the field, we looked at the time, the universal health coverage plan was not out, but there was a monitoring tool that was used to capture, I would say, the priority areas that, the government of the day was very interested in. And issues related to WASH or WASH indicators were not adequately measured in that tool. A lot of emphasis was given to, the number of people enrolling in this program, that is the Universal Health Coverage Program, and also the financial aspect of it and the pharmaceutical aspect of it. But the issue of the quality of the service that has to do with, providing people with water and various, WASH indicators was not really captured in these tools. So after we did this policy review and engaged healthcare workers as well as some key informants from the Ministry of Health, one of the main results that we came up with, and it's a paper that we have published in International Journal for Environmental Research and Public Health, is the need to strengthen WASH monitoring and measurement, as well as the enforcement of these policies. The next one I would like to talk about is the need to strengthen emergency preparedness with a focus on context-specific service, context-specific solutions. For example, as I said, pre-COVID, during my field work, a lot of the issues that came up were, emergency preparedness with regards to disease outbreaks like malaria, malaria and cholera and all that. And another thing that came up was the issue of climate variability, which has to do with drought impacting the availability of water, but also droughts and floods impacting the water service and wash infrastructure in these places. So we're looking at, emergency preparedness from those aspects. And a lot of the key informants talked about the fact that, the health referral system in Kenya was quite efficient, but also dependent on, access to basic resources. And I think when COVID hit, we went back to talk to key informants, but it also, brought up that issue of the need for us to go back to, working on people having the basic needs, that those are the wash services, because when COVID hit, most of the non-pharmaceutical interventions were all hygiene-based, practices, and these services that a lot of people do not have. So the second one that I would highlight on today is the need to strengthen emergency preparedness with a focus on, wash services and other basic services. Thank you.
Thank you so much, Thelma, for that. And I would like to call on Elijah. Elijah, maybe you can also introduce yourself and please briefly just tell us what your field of expertise is and what did you work on and who did you work with?
Thank you, Dr. Karanya, and thanks to the organizers of this conference. So my name is Elijah Bison. I'm an assistant professor at Queen's University in Kingston, and I did my PhD with Dr. Susan Elliott. And my community placement partner was Kohesu. I'm sure Dr. Karanya knows that. So I worked with Dr. Karanya's organization. So my research interests broadly center on water insecurity and health, particularly the role of trust in collective action for addressing water insecurity challenges. I'm also interested in women's empowerment in relation to water and sanitation interventions. So when interventions are given or rolled out in the community, what are the effects on gender outcomes, basically. My PhD work was on community collective action for improving access to water in the Lakeshore community in Kenya. So the community is just located on the shores of Lake Victoria. So basically, we're trying to look at how can researchers, governments, local government agencies, and community-based organizations like Kohesu mobilize existing social and cultural resources at the community level to address safe water and sanitation challenges. In terms of outcomes, yes, I think the first one is I got a PhD out of it. But the more important ones, I should say, are that first, I worked with the host organization, Kohesu, to mobilize the community to address water and sanitation challenges. And one of my proudest moments is that at the end after about 3-4 years of intense community mobilization efforts, the community finally got access to water and sanitation. Another outcome that I would like to highlight is the community partnerships and the networks during my placement. So as mentioned by Ngala in her talk, the placement is an extremely important aspect of the program. And I built my own networks through those placements. And after my PhD, I managed to write grants with some of those placements organizations. And we continue to collaborate and do research beyond the QS program. So the community placement is an important, it's a very important aspect. And the project also had very significant impacts. So lots of social and economic outcomes associated with the water and sanitation intervention. So people reporting time savings, and based on the improved access to water and the improved access to water and sanitation. And also even people were able to have some rest through the time saved on, because there was access to water and sanitation. Another important outcome that I would like to highlight is that because of the significant amount of time I spent in the field, beyond the normal traditional publications, we're also able to publish papers on the science of community building and the science of community mobilization as well, because the extended time gave us the opportunity to observe what was happening in the community, engage with the with community members and other partner organizations. So we're able to have a couple of papers that talked about community mobilization. How can you bring people together to address water and sanitation challenges, basically? So those were some of the outcomes I would like to highlight for now. Thank you.
Thank you very much, Elijah. And Inonge, perhaps we can move on to you now. Would you like to just briefly introduce yourself and tell us what your field of expertise is right now and what you worked on in the Queen Elizabeth Scholars Program, and also who you worked with?
Thank you. Thank you very much, everyone, and good afternoon. Here it's afternoon in Zambia. So thank you very much. My name's Inonge Milupi. I'm a lecturer at the University of Zambia. And currently I'm the head of Department for Language and Social Sciences in Education. Specifically, I'm an environmentalist. I did my PhD in South Africa in 2018, and it looked at environment and society. So generally, I'm an environmentalist. That was 2018. So 3 years ago, I embarked on the Quest scholarship. I managed to get a scholarship with the help of some Canadians that came to Zambia, and specifically in Western Province. So I am one of the postdoctoral researcher. I remember from the first presentation, it was about 21.9% of postdoctoral research that is coming from Quest. So I'm one of those that benefited from that research. Okay, so basically I'm a lecturer at the University of Zambia, and mostly I lecture in courses like ecology, environmental management, all the courses that relate to environmental issues. Under the Quest, I looked at the impact of floods in an area which is prone to floods. Every year in, every year out, the area gets flooded. So basically, I looked at the impact of floods to that specific area in Western Province of Zambia. So I focused on the water supply. Where do the people get the water from when the area is flooded? Where do they get the clean water for drinking and also for preparing their food? I also looked at the focus also was on the sanitation and health issues, because during the floods, the area is all flooded and all the latrines are submerged. So the interest was to look at what is the impact of these floods to human health in general. So that was my focus. So, and then from that study, I was able to get information from the local people, from the traditional leaders, and also some government officials that relate to water and sanitation in the province. So basically, I used the questionnaire. I also used the interview guide. I also had a chance to have to interview the traditional leaders to find out their role where it comes to managing those floods. What is the role of traditional leaders or the local people? Or are they sidelined when it comes to issues that relate to them? So that was my focus. Okay, so from that study, I was able to collect information. And in addition to that, after collecting my data, I was able to, at least I managed to come to Canada. I was there for 6 months, I think from July to December, okay? Unfortunately, it was a time when there were a lot of restrictions with the COVID, but within that restrictions, I managed to visit the areas such as Saskatchewan. I went to Saskatchewan. My co-supervisor is a lecturer there at the University of Saskatchewan, Corinne. I also went to British Columbia to visit another professor there. These are all working in a lot different projects in Western Province of Zambia. So I managed to work with them, like we do collaborate with them. So I visited them. I was able to present my work in Saskatchewan to students there that are under the supervision of Corinne, who is also was also my co-mentor. While at the University of Waterloo, I was under the supervision of Professor Craig in public health. That's where I was attached. And also Vicky, who is from British Columbia. So those are the people that helped me to come up with all my publications to help me in my study. The interest was really to see what we can do to the local people in the Western Zambia, especially when their area is flooded. You discover that even to access health facilities, it becomes a challenge. The transport system is a problem. So what really happens to the people's lives during the floods, and it takes almost like 4 or 5 months, the area is flooded. So we're hoping the findings of this study, we're hoping to recommend to the government to see how we can help the local people in that area. Of course, questions were coming out to say, but why can't people go to the upper land and stay? So these are the people that have lived in those areas for many, many years. These are the traditional people, so they cannot just leave their places. So the only thing we can do is to help them manage their lives during the floods. So we are trying to come up with from the study, we have maybe 3 publications. One has been published already. We have 2 more papers to be published. So the other paper specifically, we are looking at the role of traditional leaders, where it is concerned with improving sanitation of the local people in those prone areas. Most of the research on water and sanitation usually relates to piped water. In such areas, piped water cannot work because of the terrain, the way the land, it's a flood-prone area. So there should be other means and ways to try and protect the people or help their lives or improve their lives. So that is what we are working at. So, and also one of the recommendations that came from our study is that we want the stakeholders, such as the government departments, those that are involved with the issues of sanitation, the issues of health issues. You find that during the flood period, a lot of people suffer from what we call malaria. Okay, because those are breeding grounds for mosquitoes. So a lot of people have those health challenges. So want to find out what can the Minister of Health, for example, do when it comes to such challenges. What about the Minister of Education? Remember, education is very, very critical when it comes to sensitizing the local people. So we need each and every stakeholder to come on board and see that which they can do to help those local people. You've seen the issues of healthy issues, of environmental issues. It is not a one discipline issue to control everything, but it calls for multidisciplinary aspect. Everyone is supposed to come on board to come and help solve these issues. Environmental issues are not just for one department of one ministry. So therefore, what I've learned from this collaboration, from this scholarship is that, yes, the issues are supposed to be resolved by each and every individual, or all the disciplines should come on board. I am an environmentalist, but I found myself in the water-related issues, in health issues, to try and solve all these problems. So the lesson that I've learned from this collaboration is that there is need to collaborate with each and every individual, each and every discipline to solve all these environmental issues. Because if the environment is degraded, the health will also be compromised. So when we resolve environmental issues, we're also resolving all the health issues that relates to each and every individual. And doing so, it is also helping us to answer goal number 6, SDG number 6. When we resolve those issues of sanitation in the Barose floodplain, we are also trying to answer goal number 6, where it talks about clean water. Our people will have clean water. Our people will have good sanitation. And when that is addressed, it means that the health of people will be resolved. It will be resolved. So maybe I can end up there for now. Thank you.
Thank you very much, Inonge, for that sharing. And the question of flooding, and from the way we even heard from the keynote speech, is becoming a global issue, and the issues and the dealing with it is going to become really a global issue. Thank you very much for that sharing. If I may go back to Thelma. Thelma,
Yeah.
I would really like to ask you how you experience this setup of the QUEST program with international collaborators in Canada and elsewhere, because the question of collaboration was very, very critical to the QUEST program. And how did you experience also this question of embedding in and engagement in the local communities? And also, so how did these collaborations, like we've said, how did they contribute to the outcomes of your project?
Okay. So thank you very much, Diana. So similar to Elijah's experience, I also worked with Coheso, working with, Diana Karanya's team. And it was such an insightful experience. And I'll talk about my experiences in twofold. And the first is, how I was exposed to the real issues, which led to coming up with a proposal that does not only fill gaps in literature and earning me a PhD, but also capturing the real issues on the ground. And also the second part is, these collaborations with Coheso also exposed me or granted me access to organizations and stakeholders I would otherwise have not really had access to, or really have a tough time getting to meet. So moving on to the very first one that has to do with, exposing me to the real issues, I engaged in a Reconnaissance Survey where I was in Kenya in 2018. I met with Diana. We've had various discussions about this project. And at the time, Coheso was engaged in a project that provided water quality systems for healthcare facilities. Like the keynote speaker said, it's not just about concentrating on, providing the water points, but it's also critical to look at how, how safe or the quality of the water people are using in these facilities. So it was really very insightful for me to work with my collaborator to come up with my research proposal, and also, capture some of the key issues that has to do with the institutional challenges that we know face resource distribution in the Kisumu area. And then also the second part is being introduced to the communities and working with the communities. I was very lucky to be very welcomed in these communities, I would say, because all the healthcare facilities that I did go to, the nurses in charge, the management in those facilities were very willing to participate. They were very willing to talk to me. And I remember one colleague talked about the fact that they were surprised at the extent to which some of these key informants were very candid about their experiences and some of the details they shared with me. And I think I can only say I got that much detail, and these key informants were very comfortable sharing their experiences with me because of that collaboration with my research placement partner. There was that trust already with, Coheso, and by extension, I was, able to interact with these people and also, get that vital information that they provided during this research. And in a way, for me, it was also a capacity building, I would say, measure for me as well, because I got to experience what Coheso was, implementing on the ground. And they had all these projects going on, like I talked about the water quality project in healthcare facilities. They also had a women empowerment project going on in various communities. So it was interesting to see how, you know, these projects were implemented and how they were being managed. And just having that firsthand experience for me was very, very insightful and shaped, you know, some skills I have in the work that I do today. So I would say, you know, when I looked at the time when I was in Kenya working with international partners, those were some of the benefits that came up from this QS program. In Canada, I also had the opportunity as a QS fellow to work with the Canadian Association for Global Health, and working as a global health fellow also enabled me work with different global health researchers, but also learning from them and seeing how they are trying to build partnerships in their research, and emphasizing on the relevance of, you know, these partnerships, you know, to help bring change in various places or in their areas of research was also very, very insightful, and you know, I would say continue to help me shape, you know, how I go about research these days. So it wasn't just about, you know, earning a PhD, working with the community health, I mean, working with the research placement partners, but it was also about building my own capacity, learning more from you, and you know, I built those stakeholder relationships. At the end of the day, when COVID hit, we were able to go back to these key stakeholders, and all key stakeholders agreed to be part of, you know, the second phase of the research project. And I can only say we did that because, you know, we had our research placement partner. Thank you.
It looks like Diana might be frozen for a moment. Diana, can you hear us? Oh, we'll give Diana a moment just to fix her connection. There she is. Diana, we lost you for a moment, but if you'd like to resume.
I apologize. Yes, I seem to have lost the connection. Has Thelma completed?
Yes.
Yes, I have.
Sorry, I lost you there for a few minutes. Maybe we can move on to Elijah. Elijah, so what kind of lessons did you learn in your project? And since everything we've been doing is related to the Sustainable Development Goals, how easy or difficult would you say, in your opinion, is it, are these difficult or easy to achieve the Sustainable Development Goals? And what is needed for this? And what are kind of barriers would you, in your view, what kind of barriers are there? Elijah?
Thank you, Dr. Karanya. In terms of lessons, there are, beyond diseases, as we saw, and child and maternal health outcomes, as we saw in the wonderful presentation by Dr. Buta, there are other social and economic impacts when water is lacking at the household level. So, for example, people have to walk several kilometers to search for water, and the responsibility is mostly on women and children in most contexts. People don't have water for simple tasks like gardening and even meeting social obligations. A visitor comes and people don't have water to offer the visitor. Those things are sometimes associated with stigma and psychosocial distress. So one thing we learned in our project is that when access to water and sanitation is improved, beyond reducing at the community level, beyond reducing diseases and improving maternal health outcomes, but there are lots of social and economic benefits associated to that. So we did an evaluation after 2 years of the water and sanitation intervention using both quantitative data and arts-based methodologies like photo voice. And from the art-based methodologies, women really talked about significant savings related to water collection, savings in terms of time. And so they could use that extra time, some to simply rest, take a rest, and others to engage in other household activities like taking care of their kids. And some people also use the water for gardening to improve household food security. And others mentioned the fact that with the availability of safe water, they could wash their clothes and look clean. So these are some of the social and economic aspects that we should not discount, which to me was a very important lesson. The second lesson is not to discount local knowledge and also some of the capitals at the community level. And for example, the cultural capital, social capital that exists at the community level is very important for initiating and sustaining projects, particularly water and sanitation projects. In terms of barriers to achieving the sustainable development goals, first, there are lots of people who live in urban poor settlements, sometimes in slums. And some of these people are rural migrants without tenure to the land they live on. And in some cases, municipalities are not willing to extend water and sanitation services to them because it might look like legitimizing their occupation of those lands. So whilst there's a lot of work going on to improve access, some of these people are neglected in the whole conversation because of land tenure issues and just their status within cities across many countries in the global south. So we should be cognizant of that. And I think that is one of the greatest barriers to achieving the universal access to water and sanitation. The second, and is already highlighted in the presentation by Buta, there are bound to be shocks, which would derail success, perhaps in the short to medium term. Whether shocks in terms of health emergencies, like what we are seeing with COVID-19, which sometimes takes investments from some of these issues from other sustainable development goals because governments must deal with the immediate crisis, which will affect investments in the water and sanitation sector. And the other shock is extreme weather events associated with climate change, and as we are seeing with flooding that was nicely explained by Dr. Buta. These are bound to occur in many parts of the world, which would affect water and sanitation infrastructure on a continuous basis. So how do we deal with that? And I think that would be one of the greatest barriers to achieving the universal access to water and sanitation by 2030. I will stop there.
Thank you very much, Elijah, for that. Maybe if we have time, we can revisit with the others to see what they think about this development, achievement of sustainable development goals. Inonge, maybe I can move on to you. Do you recognize some of the lessons learned by your colleagues, and what are your own experiences? How are they influenced by the corona pandemic? Some of them have already mentioned the influence of corona pandemic. What about you? How was that influence?
Thank you very much. Yes, the corona was covering, it was a global issue. So even in Zambia, the impact was felt. The impact was felt, and the more severe in the rural parts, in the rural parts where, remember I talked about the flooding that happens in this flood-prone area. So even accessing the health facilities is a challenge. So the impact of COVID-19 also worsened the situation. People had no access to health facilities. They depend mostly on paddling small canoes. Imagine even school-going children have challenges when it comes to flooding period, because they have to paddle. A small child like 7 years old has to get a canoe and paddle to go to school. Same applies to accessing these health facilities. Very few, we talk about maybe another challenge is the health workers are very few in those areas. Even for them to access their patients becomes a challenge. And the COVID-19 even worsened the situation. So those are the challenges that are coming in trying to achieve SDG number 6. Yes, we are trying to reach there, but we still have a lot of challenges. It will take us several years. And the one major thing is that the local people are not involved when it comes to decision-making process, where they're supposed to be involved to also contribute to how they can manage their livelihood, for example, in such a flood-prone area. So you find that maybe projects come to the area, the local people are not involved. So even the acceptance of such a project will be a challenge, because the people have no knowledge about the project. Of course, maybe the project is trying to help their livelihood, but they have no knowledge, so they can end up refusing such efforts that the government is trying to come up with. So I see, yes, the government is trying to achieve this goal number 6 for clean water and sanitation, but we still have a lot of challenges. We still have a lot of homework to do when it comes to achieving that SDG number 6 with regard to clean water and sanitation. Maybe I can end up there.
Thank you very much. Thank you very much for everybody. Thank you very much, Inonge, Thelma, and Elijah, for sharing your experiences. I think we have a few minutes. Is there anything you would like to perhaps add, based on what you have heard from your colleagues in relation to maybe collaborations and the COVID-19 and the Sustainable Development Goals? Any of you, is there anything you've heard from your colleagues that you would like to share with us or expound on?
Yeah, if I may, I think the field placement with community partner is a really important aspect of the whole training experience. As I initially mentioned, it gives the scholar an opportunity to build their own networks, perhaps in a different country, which is very important for their career development. And the program also opens up the scholars to access to other senior scholars and experts in other universities, and that form of networking is extremely important in my experience. And I would add that thematic focus conferences like this going forward would also be very enriching for the scholars overall experiences. Thank you.
Thank you very much, Elijah. Inonge and Thelma, anything you would maybe heard from your colleagues that you would like to expound on a little bit?
So I think my thoughts are very similar to what Elijah has already said. It's I would say, I remember when I was we finally decided my research would be in Kenya, I worried a little bit about moving from, I come from Ghana, West Africa, but at the time I had never been to East Africa. So I worried a little bit about, even though I was excited to go do my research in East Africa, I worried a little bit about settling in and being comfortable. But I think working with a research placement partner kind of eased all those fears about, moving into an environment where you are new, you don't really know people. But when you have a research placement partner, there's that, you have someone you can rely on in terms of, coming up with all the issues that you have to deal with moving into a community to do research, community engagement, breaking that barrier of engaging people, and also your own personal safety and security as well. So that is also very important. So it's, yeah, I'll end there. Thank you.
Just a quick one to all of you. Did you find it the necessity, because you had placement partners, maybe in low and medium income countries, and then you have Canadian collaborators, and what do you think about the interaction between the partners? Just not you, but how important is it that the two partners, work closely together? Because can you do this with just like, if the Canadian partner and the other partner, the placement partner, how closely do they need to work together?
To start with, okay. Sorry, can I continue?
Yes, go ahead.
Okay, so I would say that both partners need to work very, very closely together, because Inunge already said, the issue of, acceptance in terms of, research projects or interventions in places is very important. And when you want to build that, you want to work with, an organization that is on the ground, that knows the context, that knows the people, and that can help you build that trust as probably an international organization or as a funder. So it's very important to work closely together, so you're actually achieving your aim on the ground. And that is, I would say that is very, very important. There's a need to have that close working relationship between both the research placement partner and the international organization or funder. Thank you.
Thank you very much. And with this, I think we have come to the end of this panel session. Thank you very much, panelists. Thank you, Thelma. Thank you, Elijah. And thank you, Inonje. Thank you, audience, for listening in. And I would like now happy to hand over to Roy.
Thank you, Diana, and thank you so much, panelists, Elia, Inonje, and Thelma, for sharing your experiences. There are no questions in the Q&A box, but in the chat, there are compliments to all of you from our audience. Brilliantly done. Thank you so much. We are great on time. So we're going to have a short break now for 10 minutes. So we'll be back with you in 10 minutes time. So you have the opportunity to get something to drink or have a sanitary break. We're going to have, when we return, my colleague, Professor Greg Janes, the director of the School of Public Health at the University of Waterloo, here with us, and he will introduce the second and last panel session of today. So we hope to see you again. Stay online, but everything will go, the screen will go back to the original slide that Julie was showing, and we'll be back with you in 10 minutes time. Thank you all.
Well, welcome back, everyone. As Roy mentioned, my name is Craig James. I'm a faculty member in the School of Public Health Sciences here at the University of Waterloo. It's my pleasure to invite you all back to listen to, I'm sure, what will be another engaging panel session. It's my pleasure to introduce the moderator for this panel, Dr. Tom Wanyama. Dr. Wanyama is an assistant professor in the School of Engineering Practice and Technology at McMaster University. He has over 20 years of university teaching experience, teaching a wide range of undergraduate and postgraduate courses, including a wide variety of interesting topics: digital electronics, electricity systems, data communication, and artificial intelligence. His research focuses on the use of AI in systems control and development of computer-based tools for personnel training. So Tom, over to you.
Thank you very much, Craig. And welcome everyone to the second panel session. As already introduced, my name is Tom Wanyama. I am the chair of the Automation Engineering Technology Program in the Faculty of Engineering here at McMaster University. We are based in Hamilton, Ontario. My background is electrical and software engineering, and I'm also a former Queen Elizabeth Scholar. And in that area, my research focuses on using IoT, artificial intelligence, cloud computing, and big data to improve maternal health in rural communities through improved water, sanitation, hygiene in healthcare facilities. And now the purpose of this session is to hear from our panelists, who they are, what they have worked on in the Queen Elizabeth Scholars Program, what the practical outcomes of their projects were, how they experienced the international and local collaborations, and how these collaborations helped the successful outcomes of their projects, as well as what lessons they learned. Now, I would like to start with you, Elizabeth. Can you please briefly introduce yourself? Tell us what your field of expertise is, what you worked on the Queen Elizabeth Scholars Program, and with whom?
Thank you so much, Tom, and the organizers of this particular conference. It seems that some people are not really able to hear us clearly. I don't know whether I'm clear to.
You're very clear.
Okay, sounds good. Yeah, so basically my name is Elizabeth Onyango, originally from Kenya, but in this program, the QES Scholarship Program, I was lucky enough to really do my PhD work with Professor Susan Elliott at the University of Waterloo, where my research work focused on exploration of what matters to Kenyans in terms of understanding their health or conceptualizing their health and well-being. And this particular work was quite interesting in the sense that it gave lay people an opportunity to really put forward their thoughts about what they value, what really becomes important when we are measuring health and well-being. One key thing that resonated a lot with Kenyans is the fact that we need to be able to really embrace things like historical perspectives, historical experiences. So for example, when I spoke with Kenyans from the central region, a lot of the seniors talked about issues of land ownership and how being a squatter and not having a land with which to identify as a home would really contribute towards people having a negative perception or negative views about their own health and well-being. And in that particular context, I realized that the seniors are really taking a key role when it comes to taking care of their grandchildren, taking care of their children, who, because they don't really have a place to call home, in that context, land is not there, they don't own any land, would then migrate into the cities in search of greener pastures, but then they end up in the informal settlement where they in turn maybe engage in other things, get kids, and then these kids are sent back to the grandparents in these rented places or in this uncertain environment where they don't even know what's going to happen in the next few years. So then that really created an interesting kind of a discussion that moves beyond the normal kind of measurements that we see being used in evaluating what health and well-being really means to people. But I think that's one thing that I found quite interesting. So when I looked at another kind of population, the youths, I think issues to do with people's perception, issues of trust, was quite important to them, where the male youths, if they come in and do some agricultural or try to do personal kind of investments to generate income, people don't trust the source where they're coming with these goods that they're coming into the community to sell. So they're seen as either thugs or thieves or some mistrust kind of a thing that really informed their own health and well-being. So I found that there are specific aspects that really matter to people based on their own perception of health and well-being, and we need to be able to really consider some of these particular issues when we are talking about health and well-being. And in general, one thing that cut across the entire country was the issue of food security, and then also how food security relates to gender-based violence, where people talked about experiencing economic hardship and also social and cultural erosion that's taking place. People are not so much attached to each other. And because of that, people end up in households or in families having gender-based violence experiences, but then because they don't really have those strong connections as they used to have, they're not able to really have some support systems, strong support systems in place. So moving forward, I think this really informed my research interests. And I was lucky enough, after finishing my Queen Elizabeth scholarship as a PhD student, I got a postdoctoral position as a Queen Elizabeth Advanced Scholar at the Balsillie School, where I then moved forward to also explore issues of food insecurity within Nairobi and other African countries or other African cities. So for example, I worked closely with the Hungry Cities Partnership with Professor Jonathan Crush. And in this particular role, I was able to really understand more about urban food insecurity, migration issues, and how interconnectivity to rural communities or even sending of remittances really contribute towards some coping mechanisms that people have in those particular contexts. And that being said, I think the connections that I built through the QES scholarship program, because at the Balsillie School, I got an opportunity to also be attached to MEDA, which is the Mennonite Economic Development Associate, a non-governmental organization that works with people or even partners within the Global South. So in that program, I was attached to their Nigeria Way project, which works with women and girls, aiming towards economic empowerment, helping girls understand that they also have a voice and they can also speak for themselves and be involved in decisions relating to early marriages and some of the negative experiences they are having just because they are pushed into getting married at an early age. So those particular connections, I think, really created an opportunity for me to really move to what I'm currently doing as an assistant professor at the University of Alberta. And in this particular role, I think my research work really works towards exploring food insecurity issues, gender-based violence issues among immigrant populations, both within Canada and other partners, which I think came along because of the connections that I built through the partner or even the community engagement work that the QES scholarship afforded me. And that being said, I think there was also, in terms of community engagement, having moved from Kenya to Canada, I was able to also take part in different activities within the Canadian context. And those things have really created an opportunity for me to connect very closely with the Canadian population, while also maintaining my linkages back in my country, Kenya. I think I'll leave it at that for now.
Thank you very much, Elizabeth. I hope my audio is better now.
Yes, it sounds good.
Thank you. Now move on to Buba. Please briefly introduce yourself.
Oh, Buba was here. He just looks frozen. So
I think he looks frozen.
He does. Maybe we could move on to Andrea and give Buba a minute to get his connection back.
Thank you. Yes, I think Andrea is here. Andrea, can you please introduce yourself?
Yeah, for sure. Thank you for this opportunity and nice to see everyone. So my name is Andrea Rishworth and I'm currently a postdoctoral fellow at the University of Toronto Mississauga campus. My training is in health geography and my research interests lie in global health equity, environmental change, and gender and health. I'm particularly interested in understanding the complex human environmental interactions that shape uneven experiences of health and well-being, and also exploring the possibilities for healthier lives. So my work in the QES program occurred during my PhD program, where I worked closely under Dr. Susan Elliott at the University of Waterloo. So my project here examines how older adults in Uganda navigated health and well-being in the context of socio-ecological, geopolitical, and physiological change. So to do this, I worked closely with a local NGO in Uganda called ROTOM, the Reach One Touch One organization, which provides health and social support, fellowship, food and housing, amongst many other services for older adults and children under their care in Uganda. And they've also now expanded to Ethiopia too. So my research involved 2 field seasons where I worked closely with ROTOM staff and research assistants to engage older adults in surrounding areas. So after the data was collected, I organized a day-long workshop which brought together ROTOM, community members, older adults, health providers, and other community organizations, and decision makers from Uganda, Kenya, Ethiopia, Canada, and individuals from the United States in Mukono, Uganda, to share the results of this research and build connections with others who share similar interests in the areas of aging, health, and well-being. So on one level, this workshop allowed me to share the main empirical findings from this research, which found that older adults who identify as men and women experience multiple yet different forms of marginalization and inequality that undermine opportunities for aging, health, and well-being, but at the same time enact various forms of agency and resistance to generate hope in changing environments. But on another level, the event offered a platform for ROTOM and other organizations in the region to present the work of their organizations, build collaborations, and integrate our work together. So the morning session focused on presentations and discussions, and the afternoon session was built around a series of roundtable discussions that asked what can we do with this information from all of our research and our organizations, and what questions do we still need answers and what questions do we still need to address, and what do we need answers for? And so this allowed us to work together to build a future research agenda on issues of aging in East Africa. So following this event, I analyzed transcripts from the workshop and found that by the end of the event, participants acquired new and important information on the realities of aging. They felt more confident and empowered to educate the broader public on the challenges associated with aging. They felt confident to collaborate and integrate with other organizations to address aging inequities. And they also felt capable of engaging and educating disconnected government ministries at the district, regional, and national level about concerns of older populations in Uganda and East Africa and Africa more broadly. And at the end of the project, the executive director of ROTOM even shared that they better understood the value of research and actually expanded an organizational objective of ROTOM to include research as a stream of their organization. So I would say those are some of the main outcomes of my project, and that's kind of my project and partnership work in a nutshell.
Progress.
Thank you very much, Andrea. I think.
Yeah, can I? Yes. Can I comment or I have to? Yes. Can I comment or I have to? Yes, I am.
Buba, you are muted. Please unmute yourself.
Yes,
And
thank you
then
very
go
much.
ahead.
I am Dr. Buamanyang. I work with Professor Susan Elliott, benefited from the program at the University of Waterloo, the scholarship program, of course. We worked in different areas, but I was working at the Water Institute. My experience from the University of Waterloo with Professor Susan and all the team members, it really helped me to contribute a lot in the Gambia with regard to issue of public health and emergency response. So when I came back in 2020 after completing the work in Waterloo, we were the main players in control of COVID-19 outbreak in the Gambia. We were able to form our response team, looking at various thematic areas of prevention, preparing the work plan, then getting the partners, all the partners on board, and then all the structures in place, and then we're able to intervene. The first thing that we put in place was the quarantine centers, and I was the head of that quarantine center. Then we were in connection to coordinating all the points of entries in the country, and then we were able to do a lot of things in that. With regard to migration, we have people who travel from other countries. In our collaboration with IAM, we were able to get them supported before entering the country. We make sure we screen them, make sure we get them to the quarantine centers and give them all the necessary treatments. My skill from the Waterloo University also gave me an adage after returning back home. I become the Director of Public Health Services at the Ministry of Health. And then we were able to engage in terms of when you come to water quality, in terms of WASH, that is water sanitation and hygiene. We are able to form a technical working group, and this all the players were invited. Any section or agency or organization that have a role in terms of sanitation and hygiene are all called on board, because previously it used to happen each work in silos, and that doesn't help, because once we come together, we have the same focus, the same direction. So my experience from University of Waterloo helped me to bring all these players together, and then it paid dividends because we have one terms of reference. That's what we were all looking at, and then that was functioning very well until recently when we have the rainfall, and then there were floods in different parts of the country. So because of the technical working group as is in place, we are able to call everybody on board, and then we put our resources together, called resource mapping. And then each area, what you have, we put it together. And then we are able to respond efficiently in terms of chlorinating the water, in terms of distribution of aqua taps. We made best use of the Red Cross. The Red Cross agents are all over the country. The public health officers are all over the country. So we use this structure to distribute the materials. But nonetheless, internally displaced people need further support in terms of giving them quality water to drink, because otherwise there is prone of having a outbreak of cholera, which becomes worse. So we make sure that we get the water clean for them. distribute aqua tabs. And also we make sure that we talk to them in terms of risk communication, tell them as to what are the exposures they might be, affected by certain exposures, and then make sure that they pay attention to some of those things. But not only we give them supplies of sanitary materials like detergents, name it, different types, and then to make sure that they get themselves in terms of personal hygiene and the environment. We also have prepared a clinic around the end, and also provided ambulance services for those who might be sick and to be easily referred to the main treatment facilities, that's the hospitals or health centers. So basically, this helped me a lot to be more mature in terms of getting organizational functions in place, and also in terms of developing policies and engaging in series of activities in the country. Just to mention a few. Thank you. Over to you.
Thank you very much, Buba. I would like to come back to you, Elizabeth. I would now like to ask you how you experienced the setup of the Queen Elizabeth Scholars Program with international collaborators in Canada and elsewhere, and the stronger local embedding and the engagement. How have you experienced these collaborations, and how did they contribute to the outcomes of your project?
Thank you again for the opportunity to really share a bit more about my own experience in the QES scholarship program. So in terms of our community engagement, I think QES scholarship really afforded me the opportunity to be able to even enhance my own kind of community or social networking skills, in the sense that we had, I was in this particular program that I really put a lot of emphasis in terms of community engagement, in terms of being an active member in a foreign country, and even while at the same time also engaging with my community that I was familiar with. So when I moved from Kenya in 2015 to come into Canada to pursue my PhD, I think I want to acknowledge the fact that traversing different geographies, or a huge geography from Kenya to Canada, wasn't easy, but being that the focus of the program was in ensuring that we can be able to build some lasting connections with our communities where we are situated as QES scholars, while also maintaining those linkages, I was able to really engage myself within my community, within Waterloo. And I think that really expounded so much to even other international countries based on the two QES scholarships that I was part of. So within Waterloo, I was involved in the local initiatives within the Waterloo region. So for example, coming into Canada, I think the first starting point for me was my church community at Waterloo Pentecostal Assembly. And at that point, my kids stayed home, and I was in this community, and with my passion working with kids, I decided to volunteer to work with kids within the church. So when I did that, I think it just allowed me to realize how much I can contribute to the community where I was, because from there, I then got attached to Welcome Refugee Home, which is a local institution supporting newcomers within our Waterloo region. So I got involved with welcoming Syrian refugees, and that allowed me to realize that coming from a foreign place, or coming from a far place where you've left your social networks, you've left a familiar environment, and you're coming in, there is need to be able to support people in that kind of a space. So I was able to really support some of the newcomers from Syria, and I think some also from some African countries that were coming through Welcome Home. And then from there, I got a recommendation to really get to work with children living with autism in the region, because I think just having been available to work with the vulnerable population, I think this agency saw it better to really grant me an opportunity to also explore my interest in working with children. So I think from there, it just created a spin of many other community engagement where I ended up now working with the African migrants within Waterloo region, supporting youths and other children within the same context. And that created another connection to Ryerson University, now Toronto Metropolitan University, where I was involved in designing and even implementing the first anti-Black racism course within the social work department of the School of Social Work. So, and then from there, I was able to then get into teaching within the university, co-teaching and facilitating courses within the institution. And that really created just a pilot of like a starting point for other things. And I think that's how I ended up in my current role as an assistant professor at the University of Alberta, where I am currently. But just tracking it back to where I started from in Kenya, I first worked with orphans and vulnerable children within Kisumu at a Pamoja community-based organization. And that has never left my heart. I have those particular kids that I still work with to date. And I still remain a board member of that particular organization. So what I would say in a nutshell is that having this particular program, putting a lot of emphasis in our community engagement, has really created a lot of opportunity for the beneficiaries or people who've gone through the program to even realize some of the potentials that they never really had, or even if they had, it has enhanced those particular skills. And looking at my QES program at the Balsillie School, I think it's created a huge connection with some of the partners within the Asian continent, as well as in Latin America, where now I'm currently involved in some other research work with a university in Ecuador, as well as Mexico and Jamaica, and other South African countries that are part of the Hungry Cities Partnership. So it's a great thing to really have been part of the QES program. And I think it created a huge avenue for me to really take off with my research work, as well as just doing what I love doing, working in the community.
Thank you very much, Elizabeth. Quite inspiring story there. I'll come back to you, Buba. What lessons did you learn in your project, and how easy or difficult is it to achieve the sustainable development goals in your opinion? What is needed for this, and what are the barriers in your view? Buba, you're gonna need to unmute yourself.
Okay, are you hearing me? Okay, thank you very much. What I realized is that it gives me an added advantage as to how to mobilize in terms of resources, and also how to get people involved together we can achieve something. And then it also gives me the advantage of trying to improve on my career as an individual, and also nationally what the country can benefit from your skills and experience. So in a nutshell, it helped me to achieve my desired goal, that is to make sure to see a human being that we are serving get the required support from all, by all means, and whatever available opportunity prevails. And then The lesson that I learned also is that no country or individual can do this alone. We have to come together. Low and middle income countries and also countries like Canada and other countries need to work closely together. I think I noticed that COVID-19 taught us a lesson to say that we should closely work together. If there is a health issue in terms of sustainable development goal 3 and 6, when it comes to water, sanitation, and hygiene, if there is an outbreak of Ebola or outbreak of cholera in one country, we should all join together. That's what IHR comes in. That's why it comes in, international health regulations. And these regulations, as there's a regulation 2005, and these regulations are telling us that now we have to make sure we emphasize, we make control of through our concerted efforts to control some of these diseases that can cross our boundaries. So working closely together with people is very, very vital, and also sharing knowledge. And this is what CAS is doing. Queen Elizabeth, this scholarship that they're doing, they brought in people from different parts of the world to work closely together with professors at different universities in Canada. This is an advantage because experience are put together. The experience that we gain from that end are still going to be filtered down to our people at different levels. And this is the show now. The experience we gain, we're working with our people, bring our people together, and then design work plans, and then implement this work plan, and also make sure we respond to emergencies as they come by. And then this is broadening our skills and experience that we can see in other countries. So some of the challenges that we have, we need to have, one of the challenges, we need to have that political will. If the political will is not there, you cannot do all that you plan as designed to benefit your population. So we should make sure that we get the politicians involved. Once they are engaged and they understand what we are doing, you will always have the way. Your way will be supported and forwarded. One of the experiences I have when we came to the Gambia to make sure that we work, sanitation and hygiene is emphasized. We look at our health facilities after assessment. We notice that there is healthcare waste issues in this country. We engage the politicians, and we got support from World Bank. And then now we have, high-class incinerators installed already, tiered. That's when I say tiered, that means they are calibrated, and they're going in for operation. And then this will clear all the healthcare waste from our facilities. And this will, do you know the end product for this? This will protect our health workers because their health and safety should be our concern. So knowledge doesn't limit itself to where it comes from. It's spread. And then when it's spread, it affects individuals. And these individuals are products that can also play a part in development of nation. We call it sustainable development. See, so we should be players in different angles. We should support as much as we can. I encourage the CAS style of Queen Elizabeth scholarship style of getting people on board to spread all over. And also, I don't want Queen Elizabeth program to stop there, but they should come on board. We welcome them in our countries to come up with projects and programs. We have so many opportunities, so many areas for research that we need to give results, and then inform the policies, the politician, and also inform policy. Because information from our research is evidence, and policies are guided by evidence. And this evidence direct our livelihood. So I encourage people, everybody, all partners across the board to come over to the Gambia, and then the door is open for us to work together in terms of research, in terms of different projects. I encourage everybody. I hope I'm not going beyond my time. Thank you. Over to you.
Thank you so much, Boba. And I would like to come back to you, Andrea, and ask you if you recognize the lessons learned by your colleagues and what your own experiences were, and how they were influenced by the pandemic.
Yeah, thank you. Yeah, I definitely recognize many of the lessons that my colleagues shared. Politics is powerful, and collaborations, I think, are also critical too. I say there are two main lessons that I took home from my project. The first being the critical importance of using an integrated knowledge translation approach or science policy bridging in academia. So basically working in collaboration with partners throughout the entire research process. So the idea here is behind this approach is that researchers work with knowledge users or owners, whoever is really informing this project, to inform the research questions, help guide the research process, and assist with ongoing interpretation. So I found this was really critical because I'm not going in and without knowledge of the context or anything, and people with a lived experience in the realities are informing the question and the research process. So in my project, this approach helped inform the types of research questions I asked, led to new and unexpected findings, and strengthened the capacity to mobilize the research findings with those capable of actually making changes to support the health and well-being of older people. So I can do all this research and I can write a whole bunch of papers, but really what's it going to matter in the long term unless there's people there and you have partners to actually do something with the findings. And then the second main lesson related to the importance of partnership in the research process. So partnership, I think, is also critical to integrated knowledge translation throughout the process. So while I conducted research prior to my QES project, I didn't actually have the opportunity to develop relationships with organizations or build a strong research partnership. So my prior research experiences, yes, I went in without a partner and conducted research, and I left, and really there was no benefit or impact. And I really wanted to rectify that in my research moving forward. So I think having the opportunity to work with an organization and grow a relationship was critical to the success of my project, as it not only provided the opportunity to lay a strong foundation of trust for future research interactions as I've continued to work with them throughout my career, but also ask critical questions of ourselves, our partnerships, and our interconnections with colonialism, power, and historical inequities. So it really allowed us to challenge some of these issues that scholars and partnerships grapple with. So while the partnership and collaboration varied if I was on site or abroad, we always found ways to maintain and foster our partnership, which I think was also really critical to the success of the project and my continued relationship with ROTOM and other affiliated organizations now. And I have to say that my research occurred prior to the pandemic, so I can't necessarily speak to that. But I think I probably still could have conducted similar research, but it definitely would have been varied during the pandemic. But I did continue doing research projects with my partner organization and others in Uganda during the pandemic. So we found ways around it, but it's just different. So yeah, that's my experience.
Thank you very much, Andrea, Elizabeth, and Buba for sharing your experiences. Is there anything any one of you would like to perhaps add based on what you've heard from your colleagues?
I would like to say the CASE program, Queen Elizabeth Scholarship Program, is an important one. Let this be maintained. Let it be spread to more countries' engagement. We can never tell how much impact this is having. And then the more people you have on board, the more countries you have on board, the different tests of experience and exposure is realized. So we are up, please spread to more countries. Please get to Gambia, get more people. I think I'm the only one, as I know, that come on board. I don't know of another person. So if we can spread more and give opportunity to more people to come over, we should be able to form that partnership relational group to do more. Thank you very much. I say a very big thank you to Professor Susan Elliott, because I work with her and she's definitely nice to work with. Plus Professor Craig Dean and also Roy Brewer and everybody at University of Waterloo are nice to work with. And I'm looking forward to do more work with them. Thank you.
Thank you, Buba. I don't see any questions from the audience in the chat. And maybe Elizabeth, can you add something? Thank you.
Yeah, just like a last comment. I think one thing that I really appreciate about the QES scholarship is the diversity that it represents in terms of its inclusive, inclusion criteria, bringing in people from the global south and also having people from the global north move into the context within the global south and creating those kind of lasting partnerships. And one aspect that I keep on thinking about so strongly is just putting in some aspect of family inclusion and ensuring that for people who have families, there's need for that kind of support in terms of finances. I know one time I had a conversation with the people about this kind of a program where we put a lot of, or we need to put emphasis in terms of somebody who has kids. I know, like myself, when I got to Canada, my children, who were still very young, stayed back in Kenya. And I think it's created another kind of a layer that I now have to deal with, which maybe I cannot share in this platform. But it is important, or it would be quite valuable to also have that kind of a family focus when it comes to providing the scholarships. And I know that comes with a lot of cost, but then it can be able to really contribute towards addressing the SDG goals or the Sustainable Development Goals that you're talking about. If we miss that particular perspective, I think we are also creating other challenges, which then for some people, they have to live with it like for the rest of their life. So just putting out that maybe as we continue to enhance this particular program, we need to be able to be cognizant of some of these particular issues as well. Thank you.
Thank you very much, Elizabeth. We have got a question in the question and answer, and it comes from Susan. And the question asks about the impact that you saw of our research of the Queen Elizabeth scholars on the careers of younger people, on the health of populations, on networks and relationships built, and outcomes. It can be taken up by any one of you.
I think for me, I already mentioned that it has a great impact. Already I mentioned it. It has a great impact. When I returned back home, I was able to mobilize and work with partners and also other sectors, and that helped me because we all come together and we were able to accomplish so many tasks in the country in terms of responding to COVID-19, in terms of going forward with the community-led total sanitation activities in the Gambia. We are now 99% open defecation free. The only 1% that is left, there are 2 regions, some communities in 2 of the regions, and we are going in for sanitation last mile in sanitation. So it helps us. We engage. Anything that we are doing, what I learned from the CHESS program is we should not forget the importance, contribution of communities. Communities are very important. So we engage communities and then we pace them.
We seem to have lost Buba. Yes, we seem to have lost Barbara. Elizabeth, can you just have anything to add on that?
Yes. So I think one thing that I see as an important contribution is, I think one thing that Andrea already talked about is in relation to community engagement or community involvement in understanding what really matters to them in terms of their health, their well-being, in the sense that as we continue to measure the indicators of health and well-being, we need to be able to really involve the community so that we know, or we can be able to include those indicators that matter to them. Just going out and measuring mortality or morbidity rates is not enough, but we need to have the voices of the community members. We need to be able to really bring them on board and have those meaningful connections with them in our work as either researchers or community partners. And another thing that really comes out strongly in this particular work is the fact that the community themselves, they really have the knowledge, they have the know-how, and we need to be able to acknowledge the value of traditional knowledge, the local knowledge that exists as well when it comes to health and well-being measurements or health and well-being indicators. So I think those are some of the key things that we are taking away from this particular session or this particular forum. And I think Buba has already emphasized a lot on partnerships, working together with the political stakeholders, or even the politicians, the policy makers, as well as decision makers within the different contexts. So I think embracing beyond the positivist approaches to also have these social constructionist approaches into our work as we continue to work towards addressing the sustainable development goals is a very key lesson that we are coming up with here.
Thank you very much. Just one more question, then we can let us just address one more question from Florence.
We are almost done now.
And the question is, can any one of you highlight policy impact of your project? Anyone can take on this question? This comes from Florence, sorry, we have got just a few more minutes. If any one of you can highlight some policy impact of your project.
Yeah, I think from my work as a postdoctoral fellow, I ended up doing a lot of food insecurity research within the Nairobi, the city of Nairobi, and just working closely with our partner at the University of Nairobi. We were able to really demonstrate that having these interconnections or maintaining rural connections is very important for those individuals who are living in the city in terms of creating business opportunities, creating places where people can sell their goods. So for example, when I talk about that, you'll realize that within Nairobi, we have people who live in the outskirts of neighboring counties who engage in farming. And then within the communities, they don't have really a kind of a place where they can do the selling and make some money out of that. But then when they have a relative within the city and having those kind of connections and creating a suitable environment where those connections can really be maintained. People can have access to selling places or even markets where they can come in and distribute or sell their produce. Created a really enhanced kind of an environment, a situation where people would have a positive perception of their health and well-being. So we worked closely with the city of Nairobi, the county government, and we were able to propose to them a policy brief that indicated that they need to be able to create a suitable marketplace that these individuals who have these kind of connections can be able to really contribute in terms of bringing in the goods, getting people to sell their produce, and then remitting back to their communities or their linkages back in the rural community where they are coming from. So I think that's one thing that I found quite interesting, because originally there were restrictions within the city where I think the sellers had these issues with if you are on the street, selling in the street, then the municipal guards would be after you and all this. But then we now have designated markets within the city where people can meaningfully engage in businesses that support their families, and at the same time also supporting their extended families back in the rural areas. So I think that's one interesting thing that really came out from that particular work. And I think my work in that role also contributed towards an understanding of how shocks that people experience in their context or within the city, like COVID-19, drought that was happening, I think around the time when I collected my data in 2017 at the Horn of Africa, contributing to food insecurity, economic hardships that people were experiencing. So to an extent, I think just writing those policy briefs and having discussions with partners in at the University of Nairobi, and having those linkages within the county government were quite helpful in my view.
Thank you very much, Elizabeth. And with this, we have come to the end of our panel session. Thank you, panelists, and thank you, audience, for listening in. I'm now happy to hand over to you, Craig.
Thank you very much, Tom, and thank you very much to the panelists. I think this was a very important and engaging session. And actually, as I was listening to this panel as well as the previous panel, several things kept coming to mind, and I thought maybe in the last couple minutes, I might just propose a few ideas for us to think about as we go into the next couple of days. First thing, actually, that really, I think, just want to emphasize out of Dr. Bhuta's talk, and also several of the panelists brought this up as well, that is just sort of the profound level of inequality that one sees in access to water, sanitation, hygiene. I mean, this would extend to other things as well. And I just am reminded of the fact that actually the origin of modern public health systems in Europe and North America were all about water, sanitation, and hygiene. And this goes back to the mid-19th century in Canada, even earlier than that in Europe. And yet, so with tremendous advancements in public health as a consequence of a focus on WASH systems, and yet, of course, that same effort was not directed to the global South. And of course, this is related to the nature of colonialism and those colonial processes. But yet they still continue. And I was, Dr. Bhuta's comment on, wouldn't it be nice if we had loan conditionalities such that if you are to get a loan from the World Bank or the IMF, that one of the conditions was that you focus as a government on just access to water, sanitation, and hygiene services. So it's an interesting point, and I think we can't forget the nature of those global inequalities. So now we're in a situation where we're involved in really developing relatively complex interventions, and many of the panelists, both in the earlier panel discussion and this one, focus on the need for interventions to be multi-level, to be multi-scalar, that go from the policy level to the community level. As Buba pointed out, political will is essential for any of these things really to take root, and that all of these interventions, whether it's strictly related to WASH or food security or insecurity issues, have a lot of knock-on effects in terms of economic development, knock-on effects in terms of reducing gender-based violence, knock-on effects in terms of addressing the issues facing vulnerable people. And of course, as part of that, I think all of the panelists really emphasize the importance of community mobilization, local knowledge, local engagement, as Elizabeth pointed out, bringing social science, and constructivist perspectives is really critical to understanding how communities experience their lives, whether it's access to water and sanitation, or whether it's to other things. So each and every, I think as Nonge mentioned this, we need each and every stakeholder to come on board. And finally, I think with regard to the Queen Elizabeth program, I think I really want to just emphasize how much the experiences and the work of the scholars really exemplify the goals of QES and of IDRC. The mention of networking, the importance of collaboration, developing partnerships, the really importance of interdisciplinarity across multiple contexts in Canada as well as in other countries are all really kind of shown through many of the presentations. So really great set of engaging panels, wonderful keynote presentation. I want to acknowledge again the support of Jean Gallagher and Universities Canada, as well as Katie Bryant from IDRC, Dr. Butta from the University of Toronto, and of course, thank you to the audience for participating, posing questions, and so forth. And I'm looking forward to the next couple of days. I think this was a really good start, and I invite all of you back to join us tomorrow. So thank you to all.
Thank you.